Hi there, welcome back to History with Ale, and the second part of this topic about the factors affecting fixation. So, the fifth factor is the choice of the fixative. When a specimen arrives in the lab, one of the first and most critical decisions is, what fixative should we use? The wrong choice can ruin your results, and often there is no way to fix it afterward. Some situations do not need fixatives at all. For tests like immunofluorescence, enzyme studies, or a rapid diagnosis, the tissue must be frozen right away. Also, another example is when we want to preserve urate crystals for gout disease. These type of specimens are fixated in absolute alcohol because the urate crystals dissolve in water. But usually, in my experience as a histotechnician, 99% of the tissue that comes through the lab uses formalin as a fixative to preserve the specimen. The sixth factor is called penetration rate. Not all fixatives work the same way or at the same speed. Some fixatives penetrate tissue quickly but take longer to do their actual job. Others move more slowly but act fast once inside. Also, most fixation starts on the outside of the tissue and moves inward. It does not happen all at once. For example, formaldehyde, which is the most used one, enters tissue faster than any common fixative, but it keeps working for a long time by slowly cross-linking proteins. The seventh factor is a crucial step in the histology lab that often gets overlooked, and that is the tissue storage. Sometimes you will need this tissue later for additional testing, and if it was not stored properly, those follow-up studies might be at risk. Formally fixed tissue is usually safe to store long-term, especially in 10% neutral buffer formalin. It can stay there indefinitely without much issue. But if you plan to run immunohistochemistry later, don't leave it in formalin too long. Formalin causes ongoing protein cross-linking, which can interfere with IHC results. Each fixative has its own ideal storage method, so always follow the guidelines for the specific one you are using. The eighth factor is the pH of the fixative. When it comes to light microscopy, the pH of your fixative is not a big deal, but optimal pH for formalin is around 6.8 to 7.2. If the pH is too low, it can cause pigmentation, and if it is too high, it can damage tissue structures. However, for electron microscopy, pH is very important. If you are trying to preserve ultrastructural details like membranes or organelles, the fixative needs to be buffered to a pH of 7.2 to 7.4, which is close to the natural pH of body fluids. Last but not least, the ninth factor that affects fixation is osmolality. Let's break down a key lab concept. Osmolality, it refers to how many particles are dissolved in a solution. While it is not a big deal in light microscopy, it is very important in ultrastructural studies where cell integrity is critical. Body fluids have an osmolality of about 300 to 340 milliosmoles. This is considered isotonic or balanced. But what happens when tissues are exposed to solutions that are not balanced? A hypertonic solution pulls water out of the cell, causing it to shrink. A hypotonic solution lets water flood into the cell, which can make it swell or even burst. In histology, this matters because tissue samples are exposed to fixatives and some fixatives or transport solutions can cause these osmotic shifts before the tissue is properly fixed. Formaldehyde itself is not osmotically active, even though 10% neutral buffer formalin has a high osmolality. Most of that comes from inactive formaldehyde molecules, but water, which enters tissue quickly, can act like a hypotonic solution and cause early damage before fixation kicks in. To help prevent this, fixatives often include salts like sodium chloride or sodium sulfate to help maintain a safe balance. If a biopsy cannot be fixed right away, do not just drop it in saline for hours. Instead, damp a gauze with saline, squeeze out the excess, wrap the tissue, seal it in a container, and put it on ice for a short-term storage. For kidney biopsies going for immunofluorescence, special holding solutions like Michael's transport medium are used. Remember, for more detailed explanations and examples, be sure to refer to the Frida Carson textbook. And if you're following along, do not forget to like, comment, and subscribe so you do not miss the next episode. Thank you.